Sometimes we have to sedate patients who don't have perfect lab results, and that is okay. Hi, I'm Dr. Danny Rabwin, bringing you lessons from the floor, quick tips for vet students and early career vets. My patient recently was a 16-year-old neutered male cat. He was indoor-outdoor, and he had a lump on the side of his thorax that had been growing over about 10 days. And because he was an older cat, the owners were concerned that it was potentially cancer. He was a little bit lethargic and had a decreased appetite. And when he came into me, the mass that I palpated was actually quite soft and squishy, and it felt to me like there was fluid inside, and so I aspirated it. It was an abscess, and this is an indoor-outdoor cat. He had probably gotten into a little bit of a tussle. We needed to sedate him to lance, drain, and properly treat this thing. It was a big abscess. We did pre-op lab work. His chemistry panel was fine, but his CBC showed that he had an anemia, and he had elevated white blood cells. Both neutrophils and lymphocytes were elevated. And with this degree of anemia, his hematocrit showed 20% on the CBC. Our in-house PCV was between 23 and 24%, so a mild to moderate anemia. I would, if this was an elective procedure, hold off. But in this particular case, I felt like the CBC abnormalities we were seeing were probably related to the abscess that had been there for at least a week. Maybe we're seeing some anemia of chronic disease from some other situation, but his renal parameters were normal. I don't think this was CKD in this older cat. So I talked to the owners about the risks associated with sedation. We chose a really safe sedation protocol. The cat did great. We treated him for the abscess. I'm having him come back in 1 to 2 weeks for a recheck, and we'll check a CBC at that time. So don't forget, we really need to weigh the pros and cons and the risks and benefits when we decide whether or not to sedate these older guys who have laboratory abnormalities. And so it can be done safely, and like everything, it's about clear communication with your client. So make sure to save this tip, share it with your friends, and follow us for more lessons from the floor.